Hi, and welcome to the Ask Sue show. Hope everybody is all okay. And a beautiful day in Blackpool today, I've got to say. Sun is out, the sky is blue, maybe a cloud, one or two. But do you know what? It's still looking absolutely gorgeous. The birds are all nesting away, and my cats are looking in the garden thinking it's okay, we've got fat cat food, otherwise I'd have ate you. Anyway, besides the bye, you know. Anyway, hope everybody's all okay. Got to do a massive shout out to absolutely everybody who is caring and sharing on the Ask Sue radio show page and the Ask Sue radio show group. Absolutely amazing. Brilliant stories coming in, amazing people. I've had some amazing friend requests from all over the country. I would love to sit here and give you all a big shout out personally, but do you know what? If I did that, I'd be here just on one show just doing that. But massive, massive thank you very much, and a big thank you to everybody who joined our last show with regard to the BSL as well. That was absolutely amazing. Brilliant for them as well. The group is absolutely amazed by how much we brought into their group, so absolutely amazing. And they have got an auction on their page as well. And we've also got our Sue auction page, so we've got a couple of things in there that we're auctioning off, and that will raise funds for the radio show to keep it, you know, keep it going. It does take a lot to run behind the scenes, but you know what? It's all absolutely brilliant. I absolutely love it. A big thank you to three sponsors for the show today. We've got Universal Psychic Readings and Guidance, a great Facebook page. Please go and take a look. They do readings and everything. Amazing, very supportive. Also, we've got Beauty Haven with Kim. That is my eldest daughter's group. Sponsored the show, wanted to help as much as she could. She does body shop and all sorts, but also can be doing hampers and everything for you. So big hello to Kim. And also a big hello to James. He literally has got drvisits247.com, also sponsoring the show. So just type in drvisits247.com and then /Ask Sue. Click on there and have a look. Absolutely another amazing guide, good website to have a look at, especially for our American listeners. I hope everybody's okay. Now, I don't know, right? If my technology is working good today, if it's as nice as the sunshine, we'll be okay. We should hopefully have, and I'm going to say his name all wrong, so I'll get him on first, because then he can put me straight right, the Dr. Holistic himself from Belfast. Are you online?
Yes. Hello, everyone.
Hi. How
Modestas. Yes, Modestas here.
How are you doing? You okay?
Yes, very well, thank you.
Good. Now, I tell you what, to save me the embarrassment, would you please do me the favour of pronouncing your name?
Yes, Modestas. I'm from Lithuania, and I hope it's from modesty. So Modestas Jarutis is my name, and I'm trained as a medical doctor back in Lithuania, but worked in UK NHS from 2005 for quite a few years, and then moved gradually into alternative therapies and holistic health, and mainly functional medicine. So that's what I'm doing now at this moment. My main clinic is in Belfast, but I do clinics in Dublin and London as well, and I sometimes come back to Lithuania.
Right. Okay. So let's start at the beginning. How did you start off? You know, a lot of people wonder, how did you get into holistics? Did the holistics start first for you, or did you train as a doctor and go into holistics? How did it start for you?
In Lithuania, when we do medical trainings, part of trainings are all herbal trainings, acupuncture, and even now you get functional medicine part, so kinesiology and what you need to do to improve body function. So diet is a big thing because we've been under Russians for so long, and Russians are so big in fasting. You know, diet was always one of the biggest treatments, and fasting is cheapest one, so with actually greatest results. So more and more information now. Even American, listeners can find documentaries about how fasting can improve and change life, So all these things, actually, they were going side by side with modern medicine. We never been separating. In Lithuania, still herbal treatments for cancer are very, very popular, and there is no even question why not to combine them. So it's, I grown and been trained in an environment where alternative treatments were welcome and always were combined for better results.
And that was going to be one of my questions. I mean, a lot of people do seem to think that maybe that the holistic people don't go to the doctors or ordinary GPs and vice versa. So the fact that, but people can actually use both. I mean, there is a line that people do think is there, which is you're proving yourself isn't there. That it is actually where they can join forces.
Exactly. It's a little bit difficult, especially in UK and the NHS. There are so many restrictions, guidance, and that how GP must behave and what to prescribe and what to do. Therefore, if you want to do a little bit more and try different things, you can't work just under NHS. Because even acupuncture was accepted by NHS not long ago for pain management, but it's difficult to NHS consultant to combine all these things,
Yeah.
But there are plenty of doctors who wants to combine these things, and absolutely, I have. I'm very happy to combine what works best for patient. So modern medicine did many, many huge leaps and, definitely have many solutions for different conditions.
Yeah. No, I think the thing with me is, with GPs, I think my first thing would be, it takes me forever to get an appointment. I didn't realise that I was going to be ill in 4 weeks' time. Do you know what I mean?
Yes.
Yes. Now, the trouble is that when we get, I feel myself that a lot of people with ordinary doctors nowadays, you literally are rushed with a time limit, and you are literally, they are writing your prescription, and they haven't even hardly checked you out. How long do you spend with your patients? Say, if I was to come in to see you today, how long would the first consultation be?
My all consultations are 1 hour. And during that hour, I go through full medical history, the past, what happened, why, when first symptoms started, and going a little bit back even more to figure out are there any physical traumas, emotional traumas, because so many chronic conditions start when a patient is hit by, emotional stress. And dealing with that, how to deal with that. There are so many different techniques that can be used to actually disconnect from these painful, stressful events to allow body to heal itself, And, paracetamol is great for pain management, but you can take paracetamol for rotten tooth just, limited time. Eventually,
Yeah.
you will need to fix it. And the key point is finding what caused initially that, trigger for chronic condition to start. There are so many now young people who have autoimmune conditions, and they are not born with these. They were completely healthy and fine people, but something happened in their life that triggered that autoimmune attack. And if you are not willing to go back and figure out it, everything else will be paracetamol for rotten tooth.
Yeah. So with that, even looking for myself, to be fair, I was just listening to what you were saying, thinking, well, actually, yeah, it's probably right for me too, actually. Do you think that counselling and people finding out about themselves is all part and parcel of that?
Of course. When I was growing, the friends benefits that you can phone your friend and say, we need to talk, and, you can go and sit down and have a chat. I think it's somehow disappearing. People are living busy lives. They're living virtual lives. It's less and less actual, real meetings, real chats, real, kind of hugs which one doctor said to survive, we need at least 3 hugs per day. To be healthy, at least 6-7 hugs per day. So we need physical contact, physical discussions, physical chats. And, people are suffering because it's difficult to find a good friend who can listen to you. Therefore, of course, whole, counseling, psychologist services are in more and more demand. But of course, that costs money as well. So people need to be connected. People need to find someone to talk about what happened. Because if you keep any event inside without sharing, that starts hurting you physically.
Yeah. I actually feel like we're doing my own consultation here, because with me, I'm in a vicious circle at the minute. And so a lot of people who are listening will be able to take on board this. I actually had children for a start. I can blame them all on that, okay? I've had 5 children in all. I lost 1, so I've got 4 children. I put on weight after that. And various things after that have sort of not helped me after that, like losing my brother. It'll be 3 years in November, so
Exactly.
I've had the grieving and everything. And then I've had a knee problem where I'm actually, hopefully, fingers crossed, going for an operation on Monday for cartilage damage. But I'm now in this vicious circle because I'm still grieving. I don't think I'll ever get over my brother because he actually committed suicide. I'm not been able to get out as much because I can't walk as well as I could. I'm literally hobbling around to the point of I'm nearly needing a crutch but don't want to do it, if that makes sense. And the fact is, I'm fed up in myself. I can't. I'm an independent person. I like to get out there and do stuff. I used to be in a van, travelling up and down the country, lifting furniture and everything. And it literally now, I can't get out as much and I can't do as much. So I'm literally in this vicious circle. And I've actually spoken to my doctor, the GP, and she said to me, she went, the trouble is, until you get your knee done, until you get your mindset sorted, that's when you'll be able to step out of the circle.
Yeah, exactly.
What do you think?
Absolutely. If you can't discuss these issues, when you have issue in your head, it sounds completely magnified. It sounds very scary, and it's actually physically impacts you. When you say that issue to someone and you hear it, it actually feels doable, manageable, and then someone will say, oh, have you tried this? Have you tried that? I tried this and it helped me. And therefore, in clinic, I really combine, body and mind a lot, and I work together with brilliant hypnotherapists, Mandy Reed and Mags, and a lot of my patients find really easy discussion with them, because using hypnotherapy, you can go back in time in relaxed, mindful state to observe whatever happened in the past as observer. I understand that is the past. It does not need to be affecting you now. So, either, psychological discussion with a psychologist or counselor, or hypnotherapy session is really helpful to actually figure out what actually caused initial damage and how to deal with it. And a lot of information now, even if listeners know TED Talks, are about how to deal with these traumatic issues using hypnotherapy.
Yeah. Now, hypnotherapy, let's touch base with that, because I'm quite intrigued by that. I'm not being funny. I put my head on the pillow and I can't get myself to sleep. So how on earth they think they're going to get me to sleep sitting there, I'm not quite sure. But explain how does that work for people? Have you dealt with that? What's been...
Yes, I had a few sessions myself. My eyesight was starting... my arms were starting getting too short. And I thought, no, I don't want to accept that. And it is aging issue, but I am really fascinated by Maria Peer hypnotherapist in UK. She's voted the best therapist of, many years in a row. And I saw her session, how she managed to convince your subconscious that your eyesight is back to normal. And I thought, I need to try it. And I still don't need the glasses. I still can read everything. And when initially with hypnotherapist, you have just a chat discussion, which is free discussion to see, do you, like the person who will be guiding you through hypnotherapy session? Do you understand the principles? And that can be up to 1 hour discussion about, life issues and, how hypnotherapy can help. And if you go then for hypnotherapy in Belfast, it costs £100. And the session can last from 1 hour up to 3 hours, depending on, situation and what issues are coming up. Hypnotherapist is guiding you through like deep meditation, and you feel completely relaxed, and eventually you completely hear everything. You understand the discussion, but your body is completely relaxed. And hypnotherapist can talk to your subconscious and get all right answers. Exactly why, when, and what needs to be done next. That's why they can change even perception that smoking is no longer pleasurable, or even people who can't stop eating pizza, they go to see hypnotherapists that they don't have any more that craving for pizza. The same with weight management. Yeah. Hypnotherapists can, in few sessions, can convince that you have a gastric band, and body reacts and feels like, it's just half a portion can go in, no more. So it is effect of hypnotherapist talking to your subconscious and convincing your brain that, you are healthy, happy, and let's say you don't have any more, cravings for nicotine or pizza or whatever issues you have.
Right. It's my birthday coming up, right? And I'm actually thinking to myself, I might actually get my other half to pay me to go and do a bit of hypnotherapy, because that sounds really good to me. That sounds quite good.
Yes.
The thing is, I think it's the unknowing to people. When you say hypnotherapy, let's face it, we've all seen the things on stage when all of a sudden they're doing whatever. Do you know what I mean? And I think people sometimes are scared of the unknown. Do you mean?
Yes.
Even going to an holistic doctor, they don't know what exactly to expect sometimes. Do you know what I mean?
Exactly.
And I think it's not knowing what to expect almost, isn't it?
Yes, but internet is great. Now you can see what hypnotherapy session is on YouTube. You can see, testimonials of people who went through that. You can see, more and more evidence behind why and how it works. And of course, hypnotherapy is not a solution for everyone, but someone will go for counseling. Someone will go and have a few sessions with a psychologist to figure out, why someone is behaving like is behaving, and what needs to be changed. So everyone is trying to find his own or her own route and his own or her own therapist. But from my experience, hypnotherapist is one of the quickest ways of actually getting to the root cause and fixing it in subconscious level.
And do you know what? And that's the next thing, isn't it? A lot of people haven't got, and you're going to laugh at this, but haven't got the time to be ill.
Yes, exactly. Because
and they don't have time to make themselves better either. When you nowadays, like, let's face it, both parents are out to work, the kids are at school, and if they're off school, the parents are struggling because they can't have time off work, and don't you think that the whole thing of everybody's out, everybody's working, people aren't there, tea's on the table isn't like it used to be, where the mums were at home, the dads come in, tea was on the table for 5 o'clock with healthy food. Everything seems to have changed now. Do you think that's made a massive difference?
Absolutely. The busy lifestyle is not healthy. It demands from us more and more physical energy, and we don't have enough time to charge our batteries back. You know, we have less and less time for sleep. Our sleep quality is going down, and if you can't get your 7 or, you know, even at least 6 hours good sleep, you are draining your battery, and eventually you will have symptoms.
Yeah. This is the trouble. Right, we've got a few different things. So let me just have a quick look if I can send this to you. Have you seen the pictures? Did we send them to you, the pictures?
Through Facebook?
Yeah. Did they get sent to you? If not, I can soon share it to you.
So, yes, I have it up now.
Have you got the pictures of the? Have we got patient 1 with the hand?
Oh, sorry, not yet, because for some reason my internet is a little bit slow. Let's try again.
I'll just see if Sean will send them to you while we're talking anyway.
Okay.
Because at the moment I've got one person that's literally got like a dryness on her hand, but it's literally where it's going red and it gets really itchy and everything all in her hand. But it literally starts with like tiny little, almost like blisters in her hand. But also, she's got like very weak nails as well, she was telling me. Is there anything you can suggest to help her with that?
Obviously, allergies, you know, it looks like allergic reaction to something. And figuring out what exactly it is, it takes some time. And, you know, she can have at least session with any kinesiologist, and they can go through quick kind of check what exactly is causing this. But eliminating any chemicals at home, you know, cleaning products, these are usually issues for women who uses at home all, you know, cleaning Domestos and things for even the fairy, you know, that green or yellow kind of soap for washing dishes. You know, these are the biggest allergens, and they affect a lot women nails, and that's why they get so brittle and, you know, damaged. But you know, so when these things happen, you need of course, drink plenty of water, and try for next few days when allergic reaction worsens. You need to try to eat very, you know, clean food, naturally growing food, not fried, not, you know. So you need to be every condition that worsens, in my opinion, you need to become vegetarian or vegan for a few days and see, you know, how your body will react, because body is not happy with either something outside or inside. And by stopping eating bad quality food, you can straight away improve, you know, you give a chance for body to, you know, deal with it. And eliminating any possible, you know, chemicals from outside that can cause skin reaction is another.
Yeah. With brittle nails, is that something that's like can be like people always say to me, oh, you're low in iron, or you're do you know what I mean? When I hear low in iron, I always think of old wife's tale, and do you know what I mean? It always seems to be one of them things that's, you know, so you've got brittle nails, it's low in iron. Is it always the case, or is it can be concerning other things as well?
It's usually the case that food quality generally is going down, and, you know, we have less and less magnesium, iron, and, you know, selenium in our food. Therefore, now everyone understands that magnesium supplementation is necessary. There is no more magnesium in the soil. And the same with vitamin D3. So it always makes sense, especially in spring when all fresh fruit and vegetables are not yet ready, especially in Northern Ireland yet. So you need some vitamin supplementation. There are tests which are now not expensive. You can actually order. They come to your home address, and you can send away and check your levels of iron, B12, the same magnesium, vitamin D3. They send now kits for home use, and you can, just do a finger prick, few drops of the blood into the little tube and send away back into lab, and you get results back. So all these are available, online, and with very accurate results. And if someone is having symptoms, definitely, from even any GP setting, they will offer you full blood count. And of course, if you were lucky, you will get your minerals and vitamins checked.
Right, okay. Well, just to let everybody know, after the show, we'll ask yourself if you can put the links to us so that we can literally share the links and different things that we can put out there, like for the hypnotherapy and everything.
Okay, yeah, absolutely. I'll send you all these links, and you can share with everyone.
Yeah, that's brilliant. Absolutely brilliant. You must excuse me. I have even got a cold for you today as well. Right, what is the other thing? Right, quick thing. Children. Obviously, at the moment, we've got children that are picking up colds, not just me, but my grandkids as well. And they're going to school, and they seem to be having, oh dear, one after the other. And you can't send them to the doctor every 5 minutes for it. Is there anything you can suggest for them to be able to take, or what might help?
Of course, extra vitamin C always helps. And, now we are lucky we've got liposomal vitamin C, which is easier absorbed and easier getting into the cells. And, of course, trying to improve the whole immune system and immune reaction with gradual training with cold water. The cold water therapy is so beneficial to everyone. And I think kids who get these runny noses and flus and coughs, they need something more than just, vitamins and vitamin C. They just need every shower or every bath to be finished with a little bit of cold shower. This is advisable for every human, and every morning shower should finish at least with 3-5 seconds of cold shower. So that resets and reboots immune system, and gradually immune system understands this is, how, little stress, controlled stress in time and intensity, never done any harm. It helps to,
Right, fantastic. Right, I'll tell that to the daughters tonight. Right, we've got a caller waiting. Let's just see who we've got on the line. Hi, welcome to the Sue Show.
Hello. Hi, Pete.
Hi, you okay?
Hello, Sue. How are you? Yeah, I'm fine,
okay,
thank you.
I
just want to ask a question. Yes, please.
Yep.
Yeah, I just wanted to ask, it's actually on behalf of my mother. It's actually not about myself. She's got osteoarthritis, and she's quite bent over now, and she's on a morphine patch, and I'm trying to get her to try homeopathic remedies, but she's 80 and she's very reluctant. She's been to the doctor since, and now her knee has swollen, because obviously she's compensating with the way she walks all the weight onto her right knee. The question is really, is there anything that I can get her that she might be able to take? Because all I can see is a slippery path, because she's either going to end up in a wheelchair, or they're going to just keep upping her morphine, aren't they? So, and I just think this is a slippery slope.
Exactly. Morphine is just a painkiller. So morphine is not even anti-inflammatory medication. So if her joint is swollen and painful, obviously there is inflammation. So, of course, if that is so painful that she needs morphine, then, of course, pain control is necessary. But key thing is if there is inflammation, we need somehow to reduce it. And when knee is swollen and painful, of course, it needs some rest, not actively triggering that pain with every movement. And there are a lot of local creams that can be applied straight on the skin, on that inflamed skin. And, diclofenac, creams with ibuprofen, anything that has anti-inflammatory effect can be applied and massaged onto skin, 3-4 times. And of course, there are a lot of herbal, now kind of mixes that could be used as well, homeopathic remedies. One which usually helps for swollen knee is Traumil. It's a German product that can be bought online, and it's a homeopathic herbal-based cream for inflamed joints, and can be applied to any swollen or hot red area without, adding any more tablets. Yeah.
Right. Okay. Right. Well, I'll have to look into that then. Okay. That was my question. That was my only question, believe it or not. So that was it.
Thank you very much for that. How long has your mum been like this? Or how long has she been going to the doctors with this issue?
Oh, it's been going on for, a few years now, probably a good 5-6 years, but it's just slowly getting worse. I mean, she was out the other day, she walked about 100 yards, and that was her lot. I mean, she's not out of breath or anything. She just can't manage.
Yeah, exactly. If that knee is, inflamed, there is, some question is how much of inflammation is there, and if she, it would be good to check her, full blood count just to see is that inflammation already visible in blood system, and she might need other anti-inflammatories to help her to,
doctor went there the other day, and they're on about giving her an injection in her knee now. I'm going, what? But I haven't asked her what that is about yet. But because they're saying that her actual knee is actually grinding against the joints are grinding, which means obviously it's her age, isn't it? Because she's 80.
Yes, cartilage.
Do you know what I can actually say about this was I actually went in and had an injection in my knee, and they literally, the first one I had it and it did last for 3 months and I was fine. And then I went on a second one. It wasn't my usual doctor, and she put the injection in my knee. And I'll be honest, without saying the words that I actually said at the time, which I'm sure most of you can imagine, but she put the needle in wrong, and I don't know what on earth she touched, but it must have been some sort of nerve. But that one didn't do the same. And then after that, that's when my knee went worse. But then I'm looking forward to having my op done because I'm waiting to have cartilage damage sorted on Monday, actually, a week today. But then I'm being told that apparently a lot of people are having the cartilage damage sorted, but then they're having to have knee ops after. And I know what that's like, even for me. I mean, I'm 45 this year, and I'm literally absolutely hobbling around like a woman of 100, to be honest. Do you know what I mean? So, but they literally, the doctor's gone and just said, here we are, here's a box of Cocodamol. And there was nothing of that. Nothing what you're saying about, anti-inflammatories and stuff. I literally got given Cocodamol.
Yes, just painkiller. Yeah, exactly. And sometimes these injections can help because usually they inject steroids, and steroids kill all inflammation straight away. That's why if it's injected in the right area, into the right space of the knee, it kills inflammation straight away. But at that time, you have, like you said, 3-4 months to build up muscles and to actually strengthen the whole, knee structures around that you can actually use your knee more wisely and easier. Because if the cartilage or the bone, for older patients, surface is already damaged, that these injections, they work, but they work every time for shorter and shorter time,
Yeah.
That's the same as the morphine patch, by the way. Yeah, that's why she's
exactly
up to a morphine. Exactly the same. She's up to a morphine because the opium, obviously, you up it and then that'll last a short time, then it's up it again.
But,
same sort of thing,
but the
isn't
other
it?
thing is, But the other thing is that I said to my doctor, because they kept giving me these cocodamols, and she, next time I saw her, I was saying about it, and she went, oh, well, have you been taking the cocodamol? And I said, no, I haven't. And she said, but why not? And I said, because the thing is, if I think that I'm then invincible because I can't feel the pain, then I go and do more than I should, and when this tablet works off, I'm actually making it worse. They're not curing the problem, they're just blanking it off with painkillers.
Yeah, exactly. And physiotherapy, specific movement, everything is, very important. Sorry, I have a very quick call to answer. I will join you in a minute.
Okay. Right, thank you very much for calling me anyway.
Yeah, I'm going to let you go, Sue. Oh,
all right then, thank you very much for joining us.
Take care.
Cheers.
Bye.
Thank you.
Bye-bye.
Bye-bye. Right then, we'll literally just put on hold for a moment, just while we're, it sounds like the doctor's just had to take a call, so we'll just wait for him to get sorted out. Just to, by all means, please go and join Ask Sue Radio Show on Facebook. That's facebook.com/Ask Sue Radio Show. If you want to call into the show, the phone number is 001 323 870 3861. That's 323 870 3861, and that's 001 in front if you call in from the UK. We'll just have a little tune, and we'll be back to you very shortly. and welcome back to the Ask Sue show. We have got the holistic doctor on today, and very much talking about various different ailments, some of mine, no doubt. And just to let you know, if you want to call into the show from the UK, 001 323 870 3861, or if you're calling from America, by all means call in 323 870 3861. Well, welcome back to the doctor. Hi, welcome back.
Hello, Sue.
Hi. Now, we've got another patient, literally, that is I sent a picture. I don't know if you can see on the event that I sent to you. It's patient number 2, and it's, I'm going to say this wrong, so just pronounce it for me. Militia, is that right? Militia? Is that right? It's a nodular, and it's about the size of a ping pong ball. It's in the throat. If she has it removed, they may take some thyroid out. She is worried and also has MS. What can she do? What's the best option? Doctors have said it can be left, but it is so visible, it's affected her confidence, so she has to wear a scarf around the throat all the time to try and hide it.
Yes. So, the key point is, again, for how long she has it, is it growing, and when these are getting too big, they can, eventually involve other tissues, other organs. And surgically, this is not very, difficult surgery. Yes, it will be a scar after that. But if that tissue is, or that, not to say, if this is growing, if the size of this ball is growing, then it's indicator that whole process is involving more and more surrounding tissues. So of course she needs opinion of few doctors, her GP, her surgeon, who is planning and thinking how to operate that. He needs full, X-rays and maybe even computer tomography to see how deep it sits and the position. But, from other point, if she has it already for, let's say, 5, 6, or 10 years, she can wait and see, how this will progress in future. So, it's not urgent situation that she needs surgery tomorrow. And, every patient is different, and every patient makes a decision, differently.
Right. Apparently she's had it for a few months.
Okay. So it's very fresh. So if that is already sized like that, I would ask, what are risks from surgeon who is planning to do surgery, and if this is only just last few months, I think it's wise to consider surgery.
Okay, right, okay, that's brilliant. I hope that answers that for, where were we, patient 2. Let's go back up. We've got another one. Hold on a minute. My patient seems to have disappeared. Hold on a minute. Here we go. Patient number 3. What can my mum do to help her pain? She's 80 and a morphine patch. Oh, I think this is the one that's actually rang in. She takes a paracetamol to learn. Yeah, that's what we've actually done. Patient 3. That one's the one that called in. Right, hold on a minute. See, I think we've done, all the patients have actually sent messages in, so that's good. I think we're done with them. If anybody else wants to call in, by all means, give us a call in, 001 323 870 3861. What was I going to say? Now, I was actually looking at your profile. It's called A Little Bit of Stalking. And you were saying about sweet potatoes. Now,
yes.
Which vegetables are the best ones too? Which ones do the best for us?
All organic vegetables are the best ones, and we need variety of everything, so more variety you can get, every day, your body will get different nutrients, and try to eat what's locally growing now, what's actually is produced in your local area. Figure out where is closest organic farm and go directly to that farm and try and buy something that is locally grown. And these fruit and vegetable will help you to get more energy, and actually you can give chance to your body to heal and sort out problems that are maybe starting or already bothering you for some time.
Yep. So obviously, let's go on to, you just mentioned about organic. Now, obviously, there's a lot of going on about the GMO foods. What's your thoughts on the GMO foods? And and also, let's face it, a lot of people are on lower income, and sometimes the organic things can be a lot dearer when we're looking down the shelves. That the cheaper option is the GMO ones. Are we better off spending that little bit more?
Yes, of course. Everything that's GMO or modified is, for bodies, very difficult to recognize and to take nutrients from. So all genetically modified products are called frankenfoods. So they are coming down, through your digestive systems, but we're not able to take any supplements and minerals and nutrients that you can take from organically grown, maybe smaller, maybe a little bit more expensive foods. You need much less of organic food compared to, that cheap genetically modified foods.
Yeah, right. So let's now. I own up to the fact that I like my Sunday dinner. I've got the veg on and I've got my beef on or lamb or whatever. What's your thoughts on meat? Have we got any certain meats that we're best to avoid, or are you on the vegan side? And this is, can I just say to everybody, I'm not against anybody who's a vegan. I'm not against anybody who eats meat. I'm a bit like religion. I'm with everybody.
Exactly. Me the same. If you are healthy and happy and your body weight is within normal range and you have no issues, you do what you do. Whatever you're doing, keep doing. If you have health issue, obviously something needs to change. It's not, and the first thing that is easiest to implement is start drinking more still water. And second is think about the food you eat and how often you change food. And, if you are vegan and you have health issues, maybe you are iron and vitamin B12 deficient, and maybe you need, to replace them at least with supplements. If you are a person who eats meat and you have, health issues, maybe there is a signal for you that you need to have 1 or 2 or 3 days per week when you are vegetarian. So everyone is different, and my whole practice is based on personalized healthcare. So I need to find what for this particular patient will work in the long run. Every diet is great as long as you hold on it. But a lot of these diets are not sustainable. So you need to figure out what can be sustainable, what type of diet. Mike Mosley diet, 5-2 diet looks doable because you can be normal person 5 days and you restrict yourself from all sweets and carbs and, and you have only one small dinner or maybe a small lunch depending on what you fancy more. And that looks like work now for millions and millions of people. So you can't, if you don't have issues, keep doing what you're doing. If you have issues and you want to change something, you need to change the way you eat. And that needs to be implemented at least once or twice a week. I started myself 5-2 diet 3 years ago, and I started with restricting on Mondays and Tuesdays myself only to one small dinner. Now I'm eating one dinner 5 days a week, but Saturday and Sunday is free. It means I don't think I eat whatever comes, and we have Saturday and Sunday morning and big breakfast and everything, because we need these celebrations, when we have events, you need to enjoy. And food is big treats for everyone. So, but everyone needs to find what way and what restriction will work for him or her.
Yeah, absolutely. And I think, do you know what, and this is the we'll very quickly go into this, and this is the trouble, because I was literally on a van at one point, and I was literally doing, I was up and down the country, and it's easy to go to the services and go and get a sandwich, pack sandwich and everything else, because I was leaving at 4:30, 5 o'clock in the morning. And I think the trouble is, this is what I said about having a busy life. Sometimes we just simply haven't got the time.
But when you have a busy day, you only need still water. It's very difficult to understand for some people that when you are busiest, you don't eat, because when you're eating, you're using your blood supply to digest food instead of using your blood for brain and whatever you're doing. So for busiest days, forget about food. Keep drinking and have your dinner when everything is done.
You saying that, I'm at home at the moment, and half the time I do miss my dinner, to be honest, and that's when I'll eat later on at night. Now, going on from the drinking, and before anybody says, no, not alcohol, I'm not talking about, for one, firstly, water. Are we okay drinking the water out of our tap, or are we actually better off drinking the water out of a bottle that's a proper, distilled water or whatever?
I am big fan of filtered water, and I don't trust the bottled water, and I don't like that water is in a plastic. But this is my personal preference. So we have a proper filter at home, and I know that my filtered water is clean, and I, take that water in a glass bottle with me and drink through the day. For some person, they need 1.5 liters. For someone needs 2 liters. When I'm fasting, when I'm doing my 5-2 diet, I drink even more than 2 liters, because every time I feel hunger or I think, would be nice to have something, I have just another cup of still water or hot tea, herbal tea, mint tea, chamomile tea, green tea if you feel low in energy.
See, do you know what? I've got a friend of mine called Sean who's listening to the show. He's been absolutely brilliant helping us behind the scenes, and I'm sure you've seen him sharing our event and everything. We literally have this every single day, because he says to me, he tries all these teas every single day. He's on a different one and everything. I have tried some of these teas, and I'm sorry, but I just can't. They just don't hit that mark. Do you know what I mean? Some of them are like, it's just the smell of it. It's just not for me at all. So for the person that's going from
trying.
Yeah. So for the person that's going.
Like.
So if I was to go from my usual cup of tea coffee in the morning, coffee, with just about everything, what's the best one that I could try? For somebody that's wanting to go off ordinary coffee, what would you suggest would be the best one to start with? Like some people say, go on to, and they name this one, and it's like, I've tried it, and it's like absolutely vile, right? How can I go? What's the best way to go from one to another?
From what my patients really who wanted to introduce some teas in their life, they started with Melissa or peppermint. These two, depending on brand and situation, really are, I think, easiest. Of course, tea with ginger always helps to fight that hunger and everything. And another one, my kind of discovery was chaga tea. Chaga is natural mushroom, which is growing on birch tree, and you can get actually dry freeze powder, which is just a mushroom. And when it touches the hot water, you get black tea or black coffee-like drink, which has no caffeine but a lot of nutrients, and it's adaptogen. So chaga is becoming more and more popular in UK, and we have a company now in UK who brings actually chaga from Australia.
Right. I just literally, I've just got to, I want to come off my ordinary coffees, but I haven't found anything that's going to take it, I can change it to. And I think, don't you think that this is half the trouble with us, though, is that we're I don't know if it's scared of change or we just don't like change, one of the two. Do you know what I mean? We get so in the routine, don't we, of what we do.
Exactly.
It's like, let's face it, we all get up in the morning. I know I'm the worst. Get up in the morning, I've got my routine, the dog gets out, I put fresh water and whatever, and if somebody just steps in my way when I'm in my routine, then that's me messed up. And I think this is the trouble. We're even down to our coffees, we're in a routine.
Yes.
Do you know what I mean?
And body don't likes what's unknown, body likes what is in the routine, and that's why it feels so good,
I'm still thinking back to hypnotherapy. Maybe they need to change my channel of route, I think.
Yes. And exactly, hypnotherapy can help figuring out whatever, addiction you have and how to stop it.
I think I can honestly say I think my appointment would be 3 hours. So it'd be a while, let's just say.
Yeah.
Right, the other thing is, going back to grandkids, my grandkids all are drinking milk, okay? They're all above one. One is 3 now, and she loves having a glass of milk, and they'll even have a cup of tea. But what is the best milk for kids? Is it, when they literally come off the bottle and they're off the cow and gate and all the other ones, then they're being told to use the blue milk, but then we're also being told by health people that isn't good for them at all, and so what should they be drinking?
I am a big fan of natural things, and I never seen anyone having any issue with natural, full-fat, non-pasteurized milk. And we are lucky we have few organic farms around Belfast. They deliver full-fat, unpasteurized milk, and we drink it, and I recommend that to my patients and for kids. And, but this is my preference.
Yeah. Because the thing is, let's face it, the kids get so used to drinking milk all the time that they don't want to come off anything else. They'll try maybe water and stuff, but half the time, is it the same as us adults where it's just because it's what they're getting used to?
It is, but milk is good for kids. It's rich in calcium, and milk is something that every, kid or baby supposed to have first thing. So it's, don't forget that they start the life by taking milk only, mom's milk. So, it is natural way of starting life, and the milk is first nutrient that they get. So, great quality organic, full fat milk is amazing source.
Right, okay. Right, I've got Sean asking me to ask you if alkaline is better than an acid diet.
Yes, of course, because in alkaline condition, healing is starting. In acid condition, inflammation is thriving. So more you can alkaline your body, that's must for every cancer patient. For everyone who have chronic condition, they need to be as much as possible alkaline.
Okay, right. If we've got any more questions, by all means give me a message on my Facebook, or you can give us a call in on 001 323 870 3861. So are you just, did you say you were just based in Belfast? Are you also in the UK, did you say?
Yes, Belfast, Dublin, and sometimes I go to London, depending on how many patients I get there.
Right.
So usually once or twice a month, yeah.
Right, so
they
can people
phone
book...
me and I will tell, they can phone me and I will tell when next my clinic is in London. And sorry, Sue, I will need to run. I have my next patient coming. So if you would like, if there will be an interest, we can continue next Monday and we can cover more questions. And
that would be fantastic.
Great.
Yeah, certainly.
Yeah, with great pleasure.
Could you just give us an email address or phone number or something that they can contact you?
Yes, holistic doctor holisticdoctor.eu@gmail.com, and they can send me all questions. And my website is the same, holisticdoctor.eu.
Excellent. That's brilliant. Thank you very much for calling into the show. Oh, and he's gone.